I'm Dr. Amelia Blackwood, and I spent 16 years as a neurologist at Riverside General Medical Center in Burlington, Vermont, or at least I was, until I submitted my resignation 4 months ago. During my career in neurology, I've diagnosed and treated every conceivable brain disorder you can imagine: multiple sclerosis, brain tumors, severe migraines, traumatic brain injuries, and degenerative diseases that slowly steal away everything that makes a person who they are. I've witnessed medical miracles and devastating losses, cases that pushed the boundaries of what we understand about the human brain. But what I'm about to tell you is the one case that completely shattered everything I thought I knew about consciousness, intuition, and the mysterious capabilities of the human mind. A case so impossible that it ultimately forced me to question whether modern neuroscience can truly explain the deepest mysteries of human awareness. Riverside General Medical Center is one of New England's most respected neurological treatment facilities, serving patients from Vermont, New Hampshire, and upstate New York. Our neurology department handles over 4,000 cases annually, from routine consultations for chronic headaches to emergency brain surgeries for stroke victims and trauma patients. We're known throughout the region for taking on the most complex and challenging neurological cases, the patients that other hospitals can't diagnose or treat effectively. My specialization was in cognitive neuropsychology and consciousness disorders. I had published over 30 research papers on topics ranging from locked-in syndrome to various forms of catatonia and dissociative disorders. I prided myself on being able to diagnose even the most unusual presentations of neurological dysfunction. Colleagues would often refer their most puzzling cases to me, knowing I had both the clinical experience and research background to identify rare conditions that others might miss. In 16 years of practice, I had encountered cases of severe amnesia, multiple personality disorders, various forms of catatonia, and patients with brain injuries that left them in persistent vegetative states. I had seen patients who could speak fluently in languages they had never learned due to rare neurological conditions, individuals who developed extraordinary artistic abilities following brain trauma, and cases where stroke victims suddenly gained mathematical savant abilities in specific areas where they had previously shown no aptitude. I thought I had seen every possible variation of how brain dysfunction could manifest in human behavior and consciousness. I was completely wrong. The case that would fundamentally change my understanding of neurology began on a cold Tuesday morning, December 12, 2019, when emergency medical services brought in Isabella Montrose, a 31-year-old art therapist from downtown Burlington. Isabella had been discovered by her landlord in her apartment after concerned friends reported that she had missed several important appointments and hadn't responded to calls or texts for over 5 days, completely out of character for someone they described as meticulously reliable and socially engaged. When paramedics entered Isabella's apartment, they found her sitting perfectly upright in a chair at her kitchen table, eyes wide open, staring straight ahead with an expression of intense concentration. She was dressed in the same clothes she had worn to work the previous Friday, and there was no evidence of struggle, drug use, or any kind of medical emergency. Her apartment was neat and undisturbed, with no signs that anything traumatic had occurred. The most unsettling detail was that Isabella appeared to be completely aware of her surroundings. Her eyes would track movement, she would blink normally, and occasionally she would shift her posture slightly, but she was entirely unresponsive to verbal commands, physical touch, or any attempts at communication. It was as if she was deeply absorbed in some internal experience that completely prevented her from interacting with the external world. Paramedics initially suspected a severe psychiatric episode, possibly catatonic depression, or a dissociative disorder, triggered by some unknown trauma. Her vital signs were completely normal: blood pressure, heart rate, temperature, and oxygen levels all within perfect ranges. She had no obvious injuries, no signs of illness, and her physical appearance suggested she was in excellent health. The most puzzling aspect of Isabella's condition was the expression on her face. Rather than the blank, vacant stare typically seen in catatonic patients, Isabella's face showed subtle signs of active mental engagement. Her brow was slightly furrowed, as if she was concentrating intensely on solving a complex problem, and occasionally her eyes would move as though she was observing something fascinating that no one else could see. When Isabella arrived in our emergency department, I was immediately called in as the consulting neurologist due to the unusual nature of her presentation. My first impression was of a healthy young woman who appeared to be locked in some kind of profound internal state, not the typical catatonia I had seen in psychiatric patients, but something far more complex and mysterious. I conducted a comprehensive neurological examination, testing her reflexes, pupil responses, muscle tone, and sensory reactions. Everything was completely normal. Her reflexes were appropriate, her pupils responded normally to light, and her muscle tone showed none of the rigidity typically associated with catatonic disorders. When I moved her arms or legs, they maintained whatever position I placed them in, a condition called waxy flexibility, but her muscles felt normal, not stiff or resistant. Most intriguingly, Isabella's eyes would follow my movements around the room with what appeared to be genuine awareness and curiosity. When I spoke to her, even though she didn't respond verbally, her facial expressions would change subtly, suggesting that she was processing and understanding my words. This level of apparent awareness was inconsistent with most forms of catatonia or dissociative disorders. I immediately ordered comprehensive blood tests to rule out drug intoxication, metabolic disorders, autoimmune conditions, and rare toxins that might cause sudden onset catatonia. We tested for everything from LSD and PCP to exotic poisonings and autoimmune encephalitis. Every single test came back completely normal. Isabella's blood work showed the profile of a perfectly healthy 31-year-old woman with no signs of infection, drug use, or metabolic dysfunction. Next, I ordered advanced brain imaging studies. Her CT scan showed no signs of stroke, bleeding, tumors, or structural abnormalities. Her MRI was equally normal, revealing a healthy brain with no evidence of trauma, inflammation, or degenerative changes. We performed specialized functional MRI scans to examine her brain activity patterns, and the results were both fascinating and deeply puzzling. Isabella's brain showed normal activity in areas associated with consciousness and awareness, but with unusual hyperactivity in regions associated with visual processing, memory consolidation, and temporal lobe functions related to perception of time and space. It was as if her brain was processing massive amounts of sensory and memory information, but through pathways that didn't allow for normal motor or verbal responses. Dr. Patricia Chen, our staff psychiatrist, examined Isabella and found no evidence of the kind of trauma or psychiatric conditions that typically trigger severe dissociative episodes. Isabella's medical history was unremarkable. No previous psychiatric treatment, no history of drug use, no recent major life stresses or traumatic events that might explain her sudden withdrawal from reality. After 3 days of intensive testing and observation, we were no closer to understanding Isabella's condition. She remained in the same state, apparently aware, but completely unresponsive to external stimuli. We had consulted with specialists from Harvard Medical School and Massachusetts General Hospital, but no one had encountered a case quite like hers. Then on Friday evening, November 15th, something extraordinary happened that would completely change the trajectory of Isabella's case and challenge everything we thought we understood about her condition. I was making my routine evening rounds when I entered Isabella's room to find her in a completely different position. Instead of sitting upright in the chair where we typically positioned her, she was standing by the window, looking out at the city lights, with an expression of deep concentration. This was the first voluntary movement she had made since her admission. "Isabella," I called softly, not wanting to startle her. "Can you hear me?" She turned around slowly, looked directly at me with eyes that were suddenly completely lucid and present, and spoke in a clear, calm voice. "Dr. Blackwood, I need to tell you about Mrs. Richardson in room 318. She's going to have a massive heart attack tomorrow morning at 6:43 a.m. And there's something wrong with her medication dosage that's going to make it fatal if you don't intervene." I was stunned. This was not only Isabella's first coherent speech since her admission, but she was making a specific medical prediction about a patient she had never met. Mrs. Richardson was indeed in room 318. A 67-year-old woman recovering from routine gallbladder surgery with no cardiac history or risk factors. "Isabella, how do you know about Mrs. Richardson?" I asked, trying to keep my voice steady despite my shock. "I can see it," she replied, matter-of-factly. "I can see what's going to happen to people here. Mrs. Richardson's potassium levels are going to drop suddenly overnight because of an interaction between her pain medication and the diuretic she's taking for blood pressure that wasn't properly adjusted for her kidney function. The low potassium will trigger a fatal arrhythmia at exactly 6:43 a.m. unless someone checks her labs and adjusts her medications." What Isabella was describing was medically plausible but incredibly specific and detailed. More disturbing was that she was providing information about drug interactions and physiological processes that would typically require advanced medical training to understand. I immediately paged Dr. Sarah Martinez, our head cardiologist, and Dr. Chen to join me in Isabella's room. When they arrived, Isabella was still lucid and willing to engage in conversation, though she seemed slightly tired from the effort of speaking. Martinez questioned Isabella extensively about her medical predictions, trying to understand how she could know such specific details about a patient's condition and medication interactions. Isabella's responses demonstrated a level of medical knowledge that should have been impossible for an art therapist with no medical background. "The medications create patterns," Isabella explained. "I can see how they interact with each person's physiology differently. Mrs. Richardson's kidneys process the diuretic slower than normal because of age-related changes, and when combined with the specific pain medication she's receiving, it creates a cascade effect that leads to dangerous electrolyte imbalances." Chen conducted an impromptu psychiatric evaluation, testing Isabella's orientation, memory, and cognitive function. Isabella was completely oriented to time and place, could recall detailed information from her past, and demonstrated no signs of delusions, hallucinations, or impaired thinking. Her predictions about Mrs. Richardson weren't delivered with the grandiose certainty typical of delusional patients, but rather with a calm, almost scientific observation of medical facts. Most puzzling was that when we asked Isabella about her own condition, why she had been unresponsive for days, she seemed genuinely confused. "I haven't been unresponsive," she said. "I've been processing information. There's so much happening in this hospital, so many interconnected events and medical situations. It takes incredible concentration to track all the patterns and see how they're going to unfold." We immediately reviewed Mrs. Richardson's medical chart and discovered that Isabella's observations about the medication interaction were theoretically possible, though the specific combination she described was so rare that most physicians wouldn't recognize it. We decided to order immediate blood work for Mrs. Richardson as a precautionary measure. The results were alarming. Mrs. Richardson's potassium levels were indeed dropping, exactly as Isabella had predicted. Dr. Martinez immediately adjusted her medications and began monitoring her cardiac status closely. What should have been a routine recovery for a minor surgery had turned into a potentially life-threatening situation that Isabella had somehow detected days before our medical equipment or clinical observations revealed any problems. Over the next 48 hours, Isabella made several additional predictions about other patients in our hospital, each delivered with the same calm clinical precision. She described Mr. Thompson in the orthopedic wing, who would develop a blood clot in his leg on Sunday afternoon. She predicted that Miss Davis, a stroke patient, would experience a sudden improvement in her speech function on Monday morning when brain swelling reduced enough to restore function to previously compressed neural pathways. Most remarkably, Isabella began providing detailed explanations for her predictions that demonstrated sophisticated understanding of anatomy, physiology, pharmacology, and pathophysiology, knowledge that typically required years of medical education to acquire. When I asked her to explain how she had gained this medical knowledge, Isabella's response was both fascinating and deeply unsettling. "I don't have medical knowledge in the way you do, Dr. Blackwood. I can see the patterns in people's bodies, the way energy and chemistry flow through their systems. When someone is going to become sick, their patterns change days or even weeks before symptoms appear. It's like watching a complex mathematical equation solve itself over time." Dr. Chen documented everything Isabella said, trying to understand whether her predictions represented some form of medical intuition, extraordinary pattern recognition, or something beyond our current scientific understanding. We consulted with colleagues at other medical centers, but no one had encountered a case where a patient demonstrated such accurate predictive abilities about specific medical outcomes. By Sunday afternoon, Mr. Thompson did indeed develop the blood clot Isabella had predicted. Our vascular surgery team was prepared and able to intervene immediately, preventing what could have been a fatal pulmonary embolism. On Monday morning, Miss Davis experienced the exact improvement in speech function that Isabella had described, occurring at the precise time she had predicted. Each successful prediction increased both our amazement and our concern about Isabella's condition. How was she able to detect physiological changes and medical complications before our advanced diagnostic equipment or clinical examinations revealed any abnormalities? As Isabella's predictions continued to prove accurate, I began to focus more intensively on understanding her own condition. During her lucid periods, which typically lasted 2–3 hours before she returned to her withdrawn, internally focused state, I conducted detailed interviews about her experience. "When you're in the unresponsive state," I asked her, "what are you experiencing? Where does your consciousness go?" Isabella's explanation was unlike anything I had encountered in the neurological literature. "I'm not unresponsive, Dr. Blackwood. I'm hyper-responsive. I can perceive layers of information about everyone in this hospital, their medical conditions, their emotional states, their physiological patterns, but processing all that information requires enormous concentration. It's like trying to solve hundreds of complex puzzles simultaneously, while also tracking how they all interconnect and influence each other." She described experiencing what she called temporal perception, minus the ability to see how medical conditions would progress over time, like watching a complex biological process unfold in fast forward. According to Isabella, this enhanced perception had begun suddenly about a week before her apparent catatonic episode, triggered by what she described as an intense headache, followed by a brief period of unconsciousness. "I was working with a client at the therapy center," she explained, helping her process trauma through art. "Suddenly, I had the worst headache of my life, like something exploding in my brain. I lost consciousness for maybe 30 seconds. When I came to, everything was different. I could see patterns in people that I'd never noticed before, Midas medical patterns, emotional patterns, the way their bodies were processing stress and illness." This description suggested that Isabella might have experienced some kind of neurological event that had altered her perceptual capabilities, but our brain scans showed no evidence of stroke, seizure, or structural changes that could explain such a dramatic shift in consciousness. By the end of Isabella's first week in our hospital, she had made 12 specific medical predictions about various patients, and 11 of them had proven completely accurate. The 12th Midas, a prediction about a patient developing pneumonia, was prevented only because we had begun taking her warning seriously and implementing preventive measures based on her predictions. Our medical staff was divided between amazement and deep concern about the implications of Isabella's abilities. Some colleagues suggested that she might be demonstrating an extreme form of medical intuition or pattern recognition, possibly enhanced by some unknown neurological condition. Others worried that we were dealing with something beyond the scope of conventional medicine. Dr. Robert Hayes, our department chief, organized a formal case conference to discuss Isabella's condition and determine our next steps. Representatives from neurology, psychiatry, internal medicine, and hospital administration attended, along with consultants from 2 major academic medical centers. During the conference, Isabella made what would prove to be her most startling and disturbing prediction yet. She looked directly at Dr. Hayes and said, "Dr. Hayes, you need to have an immediate cardiac evaluation. You're going to have a heart attack within the next 72 hours. There's a blockage in your left anterior descending coronary artery that's about to cause a complete occlusion." Dr. Hayes was a healthy 52-year-old man with no cardiac symptoms, no family history of heart disease, and excellent annual physical examination results. Isabella's prediction seemed medically unlikely, but given her track record of accuracy, Dr. Hayes reluctantly agreed to undergo cardiac testing. The results were shocking. An emergency cardiac catheterization revealed a 95% blockage in exactly the artery Isabella had identified, minus a potentially fatal condition that would likely have caused a massive heart attack within days if left untreated. Dr. Hayes underwent emergency cardiac intervention and made a complete recovery, but Isabella's prediction about his condition had shaken our entire medical team. How could she detect a life-threatening cardiac condition that our most advanced medical screening had missed just months earlier during his annual physical? By this point, Isabella's case had attracted attention from researchers at Harvard Medical School, Johns Hopkins, and the National Institutes of Health. Neurologists specializing in consciousness research, psychiatrists studying extraordinary mental phenomena, and even physicists interested in the nature of perception and time began requesting consultations on her case. But it was Isabella's final prediction that would ultimately force me to question everything I thought I knew about consciousness, human perception, and the limitations of medical science. On Thursday morning, November 21st, 9 days after her admission, Isabella made a prediction that was so impossible, so far beyond anything we had previously encountered, that it would fundamentally change how I understood the nature of human awareness and the mysterious capabilities of the human brain. What Isabella told me about her own future and the true nature of her extraordinary abilities challenged every principle of neuroscience I had learned in my 16-year career. Her explanation was so far beyond current medical understanding that it ultimately convinced me that human consciousness operates according to principles that science simply cannot yet explain or measure. Isabella's final prediction wasn't about another patient's medical condition. It was about herself, me, and what she revealed about the source of her impossible abilities would force me to confront the reality that everything I thought I knew about the human brain was fundamentally incomplete. Thursday morning, November 21st, I entered Isabella's room to find her in what would become our final lucid conversation. She was sitting by the window, but her demeanor was different, more solemn, almost resigned. "Dr. Blackwood," she said before I could speak, "I need to tell you something about my condition that you won't want to believe, and I need to tell you what's going to happen to me in exactly 48 hours. I pulled up a chair, preparing for another medical prediction, but Isabella shook her head. "This isn't about another patient. It's about me, and it's about why I can see these medical patterns that your equipment can't detect." She paused, looking out at the Vermont mountains in the distance. "In 48 hours, at 3:27 p.m. on Saturday, I'm going to die, but not from any medical condition you can diagnose or prevent. My brain is going to shut down because it can't handle the level of information processing I've been experiencing." I was stunned. Isabella appeared perfectly healthy, and all her medical indicators were normal. Isabella, what makes you think? Because I can see my own patterns, Dr. Blackwood, just like I can see everyone else's. My brain underwent a fundamental change 9 days ago, and that change is unsustainable. I have maybe 48 more hours before the neurological pathways burn out completely. What Isabella told me next challenged every principle of neuroscience I had ever learned. She explained that the intense headache and brief unconsciousness she had experienced the week before her admission wasn't a medical event in any conventional sense. I was working with my client Sarah, who had severe PTSD from a car accident, Isabella said. During our art therapy session, she was having a complete emotional breakthrough, processing trauma she'd been suppressing for years. The intensity of her psychological release was so powerful that something happened to my brain, is like a switch being flipped that activated dormant neural pathways. According to Isabella, human brains possess far more perceptual capacity than we realize, but these abilities are normally suppressed to prevent cognitive overload. Most people can only process immediate sensory input and basic pattern recognition, she explained. But there are neural pathways that can perceive temporal patterns, biological processes across extended time frames, and interconnected systems in ways that seem impossible. She described experiencing what she called systemic perception, the ability to see how biological processes, chemical interactions, and physiological systems would develop over days or weeks. I don't predict medical conditions, Dr. Blackwood, I observe them. I can see illnesses developing in real time, like watching a slow-motion biological process unfold. The most disturbing aspect of Isabella's explanation was her certainty that this enhanced perception was killing her. Human brains aren't designed to process this much information continuously. The neural pathways are burning out from overuse. I can feel it happening. Miters like circuits overloading in my mind. Despite my scientific skepticism, I was compelled to investigate Isabella's claims. I ordered immediate advanced brain imaging, including experimental PET scans that could show real-time neural activity patterns. The results were unlike anything I had seen in 16 years of neurological practice. Isabella's brain showed hyperactivity in regions we barely understood. These areas associated with temporal processing, pattern recognition, and sensory integration were operating at levels that should have caused seizures or cognitive breakdown. Most remarkably, her brain was forming new neural connections at an unprecedented rate, while simultaneously showing signs of cellular damage in the same regions. It was as if her brain was evolving and destroying itself simultaneously. Dr. Patricia Chen brought in specialists from Harvard's Consciousness Research Laboratory. They confirmed what our scans suggested. Isabella's brain was operating according to principles that current neuroscience couldn't explain. She's demonstrating capabilities that we theorized might exist, but never expected to observe, Dr. Marcus Webb from Harvard told me. And she's right about the unsustainability. The cellular damage is progressing rapidly. We tried every intervention we could think of: medications to reduce neural hyperactivity, treatments to protect brain cells from damage, even experimental therapies designed to slow the progression of neurological deterioration. Nothing worked. Isabella's enhanced perception continued, and the cellular damage accelerated. Friday evening, Isabella spent her last lucid hours sharing insights that would haunt me for the rest of my career. She described experiencing consciousness in ways that challenged our fundamental understanding of human awareness. Dr. Blackwood, consciousness isn't localized in the brain the way medical science assumes, she told me. The brain is like a radio receiver that can be tuned to different frequencies of awareness. Most people are tuned to a narrow band of immediate sensory input, but there are other frequencies, broader spectrums of perception that can detect patterns across time and space. She explained that her condition had essentially retuned her brain to perceive these broader frequencies of information. I can see the biological patterns of everyone in this hospital because I'm perceiving the electromagnetic and chemical signatures of their physiological processes. Disease creates distinctive patterns that appear days or weeks before symptoms manifest. Isabella's description of consciousness as a spectrum of perceptual frequencies was so far beyond conventional neuroscience that it sounded like science fiction. Yet her documented ability to predict medical conditions with impossible accuracy suggested she was experiencing something real that our current understanding of the brain couldn't explain. On Saturday morning, November 23rd, Isabella entered her final withdrawn state, but this time was different. Her brain activity patterns showed she was experiencing something far beyond the concentrated processing we had observed before. At exactly 3:27 p.m. on Saturday afternoon, Isabella Montrose died peacefully in her hospital bed. There was no medical emergency, no sudden crisis, no detectable cause of death. Her brain activity simply ceased, as if someone had turned off a switch. The autopsy revealed the most puzzling findings of my career. Isabella's brain showed extensive formation of new neural connections in regions associated with perception and pattern recognition, but also severe cellular damage in those same areas. It was as if her brain had undergone months of intensive development and deterioration in just 10 days. Dr. Webb from Harvard described it as evolutionary acceleration followed by systemic collapse. Isabella's brain had essentially tried to evolve beyond its biological limitations and destroyed itself in the process. But the most disturbing discovery came when we reviewed the hospital's patient outcomes for the week following Isabella's death. 7 patients whom she had not mentioned, mitose patients who showed no signs of medical problems during her stay, developed serious complications exactly matching the types of conditions she had been predicting in others. It was as if Isabella's death had severed some kind of protective early warning system that had been preventing medical crises she could perceive but hadn't verbally reported. Isabella Montrose's case fundamentally destroyed my confidence in everything I thought I knew about neurology and consciousness. How could I continue practicing medicine when I had witnessed capabilities that defied every principle of brain science I had studied? The questions that haunted me were profound. If Isabella could perceive biological patterns that our most advanced medical equipment couldn't detect, how many other patients might possess similar but suppressed abilities? What other aspects of consciousness and perception were we completely missing in our understanding of the human brain? I spent months trying to return to normal neurological practice, but I found myself second-guessing every diagnosis, wondering what hidden patterns I might be missing, questioning whether our scientific understanding of consciousness was fundamentally incomplete. 6 months after Isabella's death, I submitted my resignation from Riverside General. I couldn't continue practicing medicine when I knew there were aspects of human awareness and perception that science couldn't explain or measure. I now work as a freelance medical writer and researcher, focusing on the mysteries of consciousness that mainstream medicine prefers to ignore. Isabella's case taught me that human beings possess capabilities that extend far beyond what current neuroscience acknowledges. The case of Isabella Montrose will always represent the most humbling experience of my medical career. It demonstrated that consciousness, perception, and human awareness operate according to principles that our current scientific understanding cannot explain. Isabella's brief period of enhanced perception gave us a glimpse into possibilities of human consciousness that challenge everything we think we know about the limitations of the mind. Her ability to perceive biological patterns across time suggested that awareness might extend far beyond the boundaries that medical science currently recognizes. Perhaps the most important lesson from Isabella's case is that we must remain humble about the mysteries of consciousness and open to possibilities that extend beyond our current scientific paradigms. The human brain may possess capabilities that we have barely begun to understand. Isabella Montrose died because her brain tried to access levels of awareness that human neurology cannot sustain. But in those 10 days, She demonstrated that consciousness itself might be far more extraordinary and mysterious than modern medicine dares to acknowledge. Isabella's case continues to influence consciousness research worldwide. If you've experienced unexplained perceptual phenomena, you're not alone. Share your story in the comments. The mysteries of human consciousness are far from solved.